Now, aid for education and health in the Pacific Island countries has fallen to its lowest level, according to the Lowy Institute Pacific Aid Map 2025, even as funding for infrastructure projects continues to rise. Andrea Mahanua reports.
The Lowy Institute Pacific Aid Map 2025 report shows that aid support for education and health sectors have dropped drastically as aid funding for infrastructure projects continues to rise across Pacific Island countries. Speaking to local media, co-author of the Pacific Aid Map 2025, Riley Duke, said support for these two areas is currently at its lowest. He said this comes at a time when education levels across the region are also dropping.
So one of the concerns that we've had in the last few years is that as more money has been spent on big infrastructure projects, that financing support, so development support for things like education and health across the Pacific has actually fallen. It's been a bit more stable in the Solomons, but generally when we look at the whole region, the total amount of development support for education is close to the lowest that it's ever been. And so as there's lots of factors dragging focus for both Pacific governments and their development partners, and things like education are seeing less support, also at a time when education outcomes in the Pacific have been declining. And so it's a trend that we are watching closely, and we do think it's something to be a bit concerned about.
Mr. Duke added it also needs to be acknowledged that infrastructure aid projects are sometimes not captured under the education and health sectors.
So it's true that these things are always interconnected. A new school is not valuable cannot be used by its community if the people, the roads aren't there to get people to it. So these things are always interconnected. I guess on the subject of education, though, when we look at the effect that the COVID-19 pandemic had on school outcomes, literacy rates across the Pacific are dropping. There's the Pacific Standardized Learning Outcomes, or the PILNES scores. And across almost all of the Pacific, they are either flat or dropping. I do agree that that infrastructure, can be sometimes more important. But the same amount of infrastructure that was available now was here 10 years ago. But more young could access better forms of education then, speaking generally. So I guess the thing is that the change has been very acute in the last few years, and it doesn't seem like the donors or broadly the Pacific countries have really responded in full to those trends yet.
Ministry of National Planning and Development Coordination Permanent Secretary Brian Linga also acknowledged that, as is the case, education and health infrastructure are not captured under these two sectors. He said for Solomon Islands, the government is mindful of the country's social sector.
I think also more present him today. I'm not telling that education and health and decline. Maybe the investment law infrastructure towards health and education may be counted as infrastructure, but him go towards health and education. So what government him try for them this time is for balancing. While you may try for a focus law resource sectors. Productive and resource sector, where him na give him maybe development economy believe the government am also mindful of social sector too. So invest to law health infrastructure, education, social sector. So for me, health and education need blood people believe.
Andrea Mahanwa for SIBC TV.